ورحمة الله وبركاته والحمد لله والصلاة والسلام على رسول الله. In this video, we will talk about Digeorge syndrome. Digeorge, also known as 22q11.2 deletion syndrome, is a syndrome which is caused by the deletion of the small segment of chromosome 22. So in the chromosome 22, a very portion in the Q arm is deleted, and the locus is known as 22q11.2. And as a result of this deletion, there is Digeorge syndrome. Since only a small portion is deleted, it is considered a microdeletion. So simply, Digeorge syndrome is an inherited immunodeficiency disorder. We would learn about it in details, but the major fact about this disease is they have poorly developed thymus or no thymus at all. So you can clearly understand that there would be defect in T cell production, and this individual would be immunocompromised. Lastly, this individual undergo cardiac complication. This disorder is typically due to a deletion. Now, due to this 22q11.2 deletion, there is at least 20 gene or more than 20 gene are deleted or affected. One of them most important gene is TBX1 gene. TBX1 gene is an important transcription factor which is present in the third and fourth pharyngeal pouch, and also it is enrichment in facial feature, heart, thyroid, parathyroid, and thymus tissue are developing. So, in the Digeorge syndrome, TBX1 gene is missing, and as a result, these structures are compromised. So, what happened when this portion is deleted? This TBX1 gene is extremely important because it is required for the development of the third and fourth pharyngeal pouch. So, going back to embryology, the third pouch is responsible for the formation of thymus and the inferior parathyroid gland. And the fourth pouch is responsible for the formation superior parathyroid gland. So when the development of this third and fourth pouch are affected, the thymus and the inferior parathyroid gland and the superior parathyroid gland are affected. Therefore, you will have thymic hypoplasia, which underdeveloped or absent thymus, and will have parathyroid hypoplasia, which is underdeveloped or absent parathyroid gland. So this individual has thymic hypoplasia and parathyroid hypoplasia. So what does this lead to? So we know that you have T lymphocyte, and these T lymphocyte actually mature in the thymus, and they play the most important role in cell-mediated immunity. So when there is thymic hypoplasia or thymic aplasia, there is no maturation of these T lymphocytes, and there is reduced cell-mediated immunity. Or this condition lead to cell-mediated immunodeficiency. Then, when there is parathyroid hypoplasia, we know the parathyroid gland produce parathyroid hormone. Parathyroid gland produced parathyroid hormone. That increased parathyroid hormone that increased blood calcium, increase the blood calcium level. So when there is a parathyroid hypoplasia, you will have reduced parathyroid hormone, which will lead to hypocalcemia, which will lead to hypocalcemia. So let us look at some facial feature that are distinct to Digeorge syndrome. So this is how our Digeorge syndrome patient would look like. He would have small low sit ears, small low sit ears, short with eye opening and enlarged nose tip, and hooded eyes, and majorly they have a very long face. So there are some characteristic facial feature of Digeorge syndrome. Now, let me tell you another important feature of Digeorge syndrome, which is present of a cleft palate. Cleft palate, so hair opening or cleft in the roof of mouth palate. So you can see the upper lips are not totally joined to each other. Now, as a result of this, there could be difficulties in swallowing, and there could be also speech related. So, this kind of differences are present in the Digeorge syndrome. Now, come the mnemonic, so that you never forget Digeorge syndrome. This mnemonic is catch 22. So whenever you think of the Digeorge syndrome, you should immediately think of catch 22. So what does the catch 22 stand for? C, cardiac defect. A, abnormal faces. T, thymic absence or abnormality. C, cleft palate. H, hypokalemia. 22 for chromosome 22 is affected. Cardiac defect. What kind of cardiac defect we might see in the patient with Digeorge syndrome? Actually, 50% of patients with this syndrome will be having an interrupted aortic arch, and 34% of this disease will be having persistent truncus arteriosus. Additionally, some patients will be with some patients will be presenting with tetralogy of Fallot and ventricular septal defect. This is a picture of tetralogy of Fallot and normal heart. Diagnosis. How we can diagnose this disease? This is very hard to diagnose. Of course, we have to look at the facial feature of the patient, and of course, the best way to diagnose this disease is by doing genetic analysis, which is normally performed using FISH. FISH is fluorescence in situ hybridization. On CBC, we would find reduced T lymphocyte or reduced lymphocyte, and the patient electrolyte would show a hypocalcemia, so low blood calcium level. If we look for the PTH level, parathyroid hormone levels, it will be reduced. Then we could have obviously should do it electrocardiogram for cardiac anomalies and renal ultrasound for kidney abnormalities, and speech and developmental assessment. Treatment. I want to discuss the management plan and the treatment for the patient who is suffering from the Digeorge syndrome. First thing, immunosystem support. What we need to do is to support the immune system. Supporting the immune system may require giving the patient a prophylactic antibiotic, which help to prevent developing infection, and also may need to give the patient IV immunoglobulin therapy. And the last thing we could do is by thymus or bone marrow transplant. Now, for the issue of the non-development of the parathyroid gland, which is responsible for the regulation of calcium in our bodies, we can give the patient calcium and vitamin D paired with calcium supplement and active vitamin D. A heart defect for patient with heart defect, We may require to do some surgical intervention to deal with each type of their defects. And this is goes also for the patient with a cleft palate. They need to do some surgery under the supervision of the maxillofacial and أتمنى تكونوا استفدتوا من هاي المحاضرة. والسلام عليكم ورحمة الله وبركاته.